How do you keep wounds clean during surgical aftercare? Keeping wounds clean during surgical aftercare is crucial for healing and preventing infection. If you have recently undergone surgery, you may wonder how to best care for your wounds. The first step is to maintain good hand hygiene. Always wash your hands thoroughly before touching the wound or changing dressings. Your surgeon will provide specific instructions tailored to your needs, but here are some general guidelines to follow. First, keep the wound dry and covered with a sterile dressing as your surgeon directs. Avoid submerging the wound in water, such as baths or pools, until your healthcare provider gives you the green light. It is important not to apply any creams, ointments, or home remedies unless they have been specifically prescribed by your doctor. Next, monitor your wound for signs of infection. Look out for increased redness, swelling, warmth, pain, or pus. If you notice any of these symptoms, contact your healthcare provider right away. Changing the dressing is another key part of wound care. Dressings protect the wound from bacteria and physical trauma. Your surgeon will tell you how often to change the dressing, which is typically once or twice daily, or whenever it becomes wet or dirty. When changing the dressing, use clean or sterile gloves if you have them. Gently clean the area with saline or a mild antiseptic solution as recommended. Pat the area dry with a clean, lint-free cloth or gauze before applying a new sterile dressing. For larger or more complex wounds, your surgeon may use advanced techniques to aid healing. One such method is negative pressure wound therapy, which uses a special device to help remove excess fluid and promote tissue growth. In some cases, surgical techniques like stitches, staples, or skin grafts may be necessary to close the wound properly. Pain management is also an important aspect of aftercare. Your healthcare team may prescribe medications to help manage pain and keep you comfortable. Preventing infection is a priority, so antibiotics may be given if there is a high risk of infection, but they are not routinely used for every patient. Regular follow-up appointments with your surgeon are essential. These visits allow your doctor to monitor your healing progress and adjust your care plan if necessary. Be sure to report any unusual symptoms, such as fever or increased pain, to your healthcare provider promptly. Remember, every patient's healing process is unique. Factors like the type of surgery, the location of the wound, and your overall health can impact your recovery. Always follow your surgeon's instructions closely for the best results. Proper wound care is key to achieving safe and effective healing after surgery. Always consult your healthcare provider for personalized advice tailored to your specific situation.